Good afternoon, friends. It gives me immense pleasure to be with you. Thank Dr. GVK for this wonderful opportunity. My topic is night shift and commercial workers. Modern society depends on 24-hour services. Night shift work common in healthcare, IT sector, transportation, security personnel. Around 16% of the workforce works non-daytime shift. Why this topic is important? Shift workers have increased risk of type 2 DM, obesity, metabolic syndrome, hypertension, cardiovascular disease, sleep disorders, and accidents in the commercial drivers, and night work is equal to major occupational health concern. Night shift work performed between 10 p.m. and 6 a.m. Circadian rhythm. Human physiology follows a 24-hour biological clock. It is regulated by hypothalamic SCN, light exposure, melatonin secretion, cortisol rhythm. Why it is important? Improving the sleep, insulin secretion, metabolism, and hormonal regulation. What happens in the night workers when the circadian is disrupted? Night work causes misalignment between the internal biological clock and the external environment. That leads to reduced melatonin, altered cortisol rhythm, and impaired insulin sensitivity. So, circadian disruption leads to metabolic dysregulation. So, night shift workers, they frequently experience sleep disturbances, that is sleep deprivation, fragmented sleep, and shift work sleep disorder, reduced sleep duration less than 7 hours, increase the risk of type 2 DM. What is the evidence for diabetes risk? Lot of meta-analysis of cohort studies. Night shift workers have increased risk, 30% increased risk of type 2 DM. The same way, systematic review on the meta-analysis shows night shift work associated with increased dyslipidemia, hypertension, central obesity, all components of metabolic syndrome. What is the connection between the sleep and the metabolic syndrome? Poor sleep strongly linked with the metabolic syndrome. Long-term night shift increases the risk significantly. What are the hormonal changes in the night workers? Reduction in the melatonin, increase in cortisol, reduction in the leptin, increase in the ghrelin, and reduction in the insulin sensitivity. So these changes promote hyperglycemia, increased appetite, and weight gain. So shift workers, they often have unhealthy lifestyle. They have irregular meals, nighttime eating, fast food consumption, reduced physical activity, and smoking and caffeine intake. These worsen the metabolic risk. What is the mealtime and glucose metabolism connection? Night eating leads to glucose intolerance and insulin resistance. So one important thing is eating at a biological night worsens the metabolic control. Early dinner fuels metabolism, whereas late dinner stores fat. Commercial drivers, they are the high risk group. They face long driving hours, sedentary lifestyle, sleep deprivation, high stress, and the irregular meals, resulting in obesity, diabetes, and hypertension. So friends, if there is no choice, you want to go for a night shift, you have to stay alert during the night shift. So you have to stay alert during the night shift when there is no choice. So because it increases the risk of accident and occupational injuries because of the reduced alertness, delayed reaction time, and micro sleep episodes. And night shift workers increase the risk of CV risk, hypertension, CED, stroke, due to chronic sympathetic activation, inflammation, metabolic syndrome. What are the other health risks? Anxiety, depression, GI issues, certain cancers. So now shift work is classified by the WHO as a probable carcinogen due to circadian disruption. So how will you screen? What are the recommendations? So night shift workers, they should be screened for diabetes, obesity, hypertension, dyslipidemia, and sleep disorders. So at the end of the day, we conclude regular occupational health checkups are important for the night shift workers. How will you prevent? The key measures, you have to maintain the regular sleep schedule. Though you are doing the night work, you have to sleep immediately after the night shift. You have to ensure the adequate sleep and uninterrupted sleep. Avoid the heavy meals at the night. You have to exercise regularly. Exposure to morning sunlight is very, very essential. Limit the caffeine after shift. What is the nutritional advice? Small frequent meals. Avoid heavy night meals. So low glycemic food you have to choose. High protein is good and good fiber. Adequate hydration is essential. So at the end of the day, meal timing is critical for metabolic health. What are the workplace interventions you will advise? So employers should implement rotating shift with adequate rest. Health screening programs is mandatory. Fatigue management is very important. Healthy cafeteria options are essential. And regular education programs is vital. What is the role of the healthcare providers and physicians? We should identify the high-risk workers. We have to counsel about the sleep hygiene, optimize the diabetes management, screen for metabolic syndrome, and we have to promote lifestyle interventions. What are the key take-home messages? So we know night shift work, it disrupts the circadian rhythm, increase the risk of diabetes by 30%, and higher risk of metabolic syndrome. Commercial drivers, risk of accidents are very, very important. And so we need to go for yearly screening, and preventive strategies are very much essential. To conclude, night shift work is an emerging metabolic risk factor. So by improving the sleep hygiene, improving the meal timings, and workplace policies, we can significantly reduce the diabetes and cardiovascular risk in the shift workers. So how to maintain the sleep hygiene? You have to treat the daytime sleep like night sleep. Sleep immediately after the night shift. Aim for 7 to 9 hours. Keep a fixed sleep schedule. Sleep immediately after the night shift. So you have to sleep immediately after the night shift. Then only you can attempt to reduce the risk of metabolic syndrome and type 2 diabetes mellitus. So you have to create a dark, quiet sleep environment. Use blackout curtains or eye mask. Minimize the noise, earplugs, white noise machines or fans. You have to avoid bright screens, mobile or TV, 30 to 60 minutes before sleep. You have to use the bright light at work during the night shift to stay alert, and 20 to 30 minutes nap before the night shift improves the alertness. Short nap during the long shift, if it is permitted, reduce the error. Avoid a long nap just before the daytime sleep. Exercise, very important. Timing is the key. Regular exercise improves sleep quality. Avoid vigorous exercise within 3 hours of sleep. Light stretching or yoga is acceptable before sleep. Be smart with the caffeine. Caffeine may help alertness early in the shift. Avoid caffeine in the last 4 to 6 hours of the shift. Avoid energy drinks near the end of the duty. Meals matter. You eat a light meal after night duty. Avoid heavy and the spicy food. Avoid alcohol to induce sleep. It worsens the sleep quality. Keep night shift meals small and protein rich. So sleeping better on night shift. One important carry home message: sleep in the day the same way others sleep at the night. Dark, quiet, light stomach and no phone. Last slide. Sleep medicines. Use carefully for the night shift workers. Avoid regular sleeping pills. Alprazolam, big no. Zolpidem, not ideal. Melatonin can be considered. Lorazepam, use only if needed. Final take-home message, very important, fix sleep habits first. Tablets are the last option. Thank you very much for the patient listening.